Friday is a day for self-care for women everywhere. It is National Mammography Day. Early detection of breast cancer could be the difference between life and death. And today is meant to be a reminder to schedule a mammography screening and encourage your loved ones to do the same. Next to skin cancer, breast cancer is the most diagnosed cancer among American women. So for Breast Cancer Awareness Month, KCTV5's Carolyn Long sat down with a surgeon who specializes in breast disease to run down the screening guidelines.
Mammograms are a little bit tricky. So we know that definitely you can't go wrong by going in, starting at age 40 and getting a mammogram every year. What we do know, though, is that there are some women that should be getting mammograms either earlier than that or should be getting tests other than mammograms.
Dr. Mindi Beahm is a breast surgeon with HCA Midwest Health and understands the guidelines can be confusing as to who needs to get a mammogram and when. The American Society of Breast Surgeons now recommends any woman over age 25 undergo a formal risk assessment with her healthcare provider to determine the game plan for screenings.
So if you have a really significant family history of breast cancer or ovarian cancer in first, second degree relatives, you're probably someone who should speak to your breast specialist between the age of 25 and 30 and have an actual formal risk calculation done to determine if you should start getting your mammograms at age 35 and actually add an MRI in with that as well. So there are other things that can also increase that risk, but, including when you had your babies and your breast density and when you had your periods and menopause.
Other red flags that may indicate a need for earlier testing: if you have a history of chest radiation at a young age, an extensive family history of breast or ovarian cancers, especially in a mom, sister, or daughter, or a family member with a genetic mutation like in the BRCA genes, or if you've had a late first childbirth or are overweight or have excessive alcohol use. 43,250 women will die this year from breast cancer, so now's the time to pay attention. The 3D mammogram's still the gold standard of screening for most women. It continues to be a great test to detect breast cancer well before the tumor can be felt by you or your doctor or before you have symptoms. Granted, it's not the most pleasurable test, but it is quick and generally more uncomfortable than painful. So why do so many women procrastinate making that appointment?
Honestly, it's usually the fear of what they might find. I think that fear and trying to ignore things that we think could be there is a really powerful factor.
Carolyn Long, KCTV5 News.
For more from HCA Midwest Health, you can go to our website, kctv5.com, and click on It's Your Health.